Well, certainly the experts here are falling short of saying that the wave is mild because people are becoming complacent and are not masking up. In your studies, how much contribution would masking or complete masking, wearing N95 masks, give, as per projection studies as well, to countries from trying to reduce cases? How much can masking help in this?
Well, one of the things we've learned throughout the pandemic is that masking really works, particularly when people use high quality N95, KN95 masks. We know this from studies of healthcare workers where they have proper equipment, have no higher rates of COVID than anybody else in the population. So we have absolutely clear evidence that masking works. So those individuals who are at risk, they're older, they have some other comorbidity, would be very wise in India to mask because it's the most effective strategy in the short run to protect yourself because it works as soon as you start masking. The other strategy, of course, is to get vaccinated if you can get access to a vaccine. And if you completed your vaccination less than 4 months or more in the past, then if it's possible, we now know that getting a third dose also helps on protection. So those are the main effective strategies right now available to individuals.
What are policy interventions that countries such as India need to take at the moment? Because we are looking at governments not wanting to impose lockdowns like it was being done initially across the Europe as well. India is shying away from imposing a full lockdown, and lesser restrictions than earlier are being imposed at this moment. What do you think could be major policy interventions that government could take at the moment?
Given all the evidence we've seen to date, major lockdowns do not seem warranted, given the greatly reduced severity of Omicron, and given how much more transmissible Omicron is. It's going to infect so many people, it will be very hard to stop the transmission. So I think the focus for policy goes from controlling infection to making sure that death and hospitalization stay as low as possible, and avoiding the disruption to schools and to the economy that can come from people testing positive and having to quarantine at home. So right now we're in this transition from thinking that we're going to stop transmission to thinking about minimizing death and hospitalization and reducing disruption. Now, having said that, the main strategies available right now for governments are promoting what works for individuals, which is vaccination to reduce, that small fraction of people who will get hospitalized and could die, as well as promoting high quality mask use. Those are the main strategies right now, given just how transmissible Omicron is and just how much less severe it is than the previous wave.
Another question I'd like to ask you, because countries are not just experiencing Omicron, there's a mix of Delta and Omicron. People in Israel are speaking about Florona, a flu with the Omicron or Corona. And there's another mutation that's recently being reported from France called IHU. So unless these mutations continue, can modeling studies be modified and changed to check whether these could have an impact on the pandemic or, as we say, the third wave?
So the key thing one of the key things we've learned through the pandemic has been how new variants have emerged. The Alpha wave, then the Delta wave, and now the Omicron wave. We've had other variants in between, but they had much less of a global impact. And the key, it's almost impossible to know where the next variant is going to come. But having said that, what we know about variants, especially as the world gets more and more vaccinated and more people have been previously infected, so there's some degree of immunity in the population, that for new variants to be successful, they need to be more transmissible than the current variant and or able to evade the immunity that individuals have. So what we call immune escape. Right. So the combination of transmissibility and immune escape is what will determine whether any new variant that comes along is going to make a difference. The variant in France so far has been around for quite some time and hasn't really spread very far. So far, no indication that it's going to be a major problem. But of course, we don't know because it's only recently been characterized for sure. Will new variants come in the future? Very likely, given everything that we've seen around coronavirus. And the real question for the future will be, will it be something like Omicron, mild, and we will just not need to really act or intervene? Or will there be new variants that come along that are transmissible, but unfortunately go back to being more severe? And we don't know when that might occur. And the best strategy for government and for individuals is the same things that we currently know, which is get vaccination as high as possible, where appropriate, use a third dose, and be ready if there is a new wave to use masks and other interventions if that new wave ends up being a severe form of COVID.
Well, India is still not vaccinated children below the age of 15. We're only vaccinating teenagers. And it is the younger population that seems to be getting infected more this time with Omicron, although there is some hope that the infection remains mild, but we still don't have any data on long COVID and how much that will impact the human body in the long run. So would you say that policy interventions on children's vaccinations should also be speeded up?
Well, I think so far there's compelling evidence that some of the vaccines are safe and effective in children between 5 and 15. And wherever possible, if countries can afford that, that would be a good strategy to reduce this risk of long COVID. The risk, as we know, of COVID for severe hospitalization and death is very low for children. Unvaccinated children, which has been one of the facts that we've seen throughout the pandemic. Age is the biggest predictor of severity by far. So, but still, there's some risk, and everybody wants to keep risk to an extremely low level for children. And so, where possible, vaccination for children makes a lot of sense.
Well, thank you for giving us that hopeful ray at the end of it, because we are hoping that somehow the Omicron virus is the last mutation that we see. But as Dr. Murray just said, there could be more mutations and we don't know. Thank you so much for joining us.
Happy to.
Thank you. Thank you, sir. Please take care. Namaste.
All right. Thanks. Cheers. Bye-bye.